Welcome, 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 everyone. We will be starting soon. We are trying to get our music together. As you all know, Mercury is in retrograde, so it impacts technology. So just give us a few moments and start filing in. I'm going to open the chat. You all can tell us where you're joining us from. And if you're joining with an organization, you can put what organization you're with.
Muy buenas tardes, muy buenas tardes. Gracias por estar con nosotros esta tarde. Estamos por comenzar. Como sabes, Mercurio está en retrógrado ahora, así que por favor le pedimos su paciencia. Si mientras tanto, por favor, coloquen en el chat de dónde se conecta y a qué organización pertenece. Gracias.
Denise, you can stop sharing. We can get started. Let me spotlight myself. There we go. Hi, everyone. Welcome, welcome, welcome. I'm going to let Claudio come forward again and give the information for the Spanish translation line if you do need that. Claudio?
Thank you. In order to access the Spanish interpretation channel, we ask you to please well, I will provide the instructions in Spanish, so it will be redundant to do in English. I apologize for that. Para poder tener acceso a la interpretación al español, le pedimos por favor que usted marque el número 844-857-5555 con el código 811-7900. Nos veremos allá. Nuevamente 844-857-5555 con el código 811-7900 y lo vamos a colocar en el chat también para que tenga facilidad. Gracias.
Thank you so much, Claudia. And then we will also have ASL interpretation from Cynthia as well. So I will pin her. Give me 1 second. Oh no, I disappeared. Give me 1 second. Me and technology. There we go. All right, we're back in business. So welcome to What's at Stake, a panel on sexual violence as a public health crisis. My name is Kay Coghill. My pronouns are they, them, and I'm a survivor of child sexual assault and rape. For my visual description, I am a light-skinned Black person with a green headband and a green shirt on. I have blonde and blue locks in my hair, and I have on white eyeliner. I am the digital director of Me Too International, a Black queer disabled activist, and an abortion doula. I am happy to be in this space with you all today, and I'm excited for the richness of today's conversation. This conversation, moderated by Me Too CEO Dani Ayers, will be an opportunity to learn from expert partners in public health, education, and survivor justice who will talk about the urgency of sexual assault as a systemic issue, its linkages, and what's needed to move beyond awareness. We will now have a member from the Me Too team, Amanda, to lead us in a grounding practice.
Thank you, Kay. Hello, everyone. My name is Amanda Bonilla. I use pronouns she, her, hers, and I am really honored to be leading our grounding today. I am wearing a Black shirt and a gray dress over it, just really comfy today, and we'll go ahead and get started. If you're comfortable with where you are, feel free to close your eyes as we begin this grounding. Together, we are about 300 folks here, so feel that comfort in knowing that you are not alone in doing this. Feel free to place a hand on your heart Feel free to place a hand on your belly and just feel your heartbeat. Feel the normal, natural breath that you have right now in this moment, not forcing anything, bringing yourself into this present moment. Perhaps this is the first time you get to be still today. Go ahead and start to deepen your breath, inhaling through the nose for 4, 3, 2, 1, holding it slightly at the top. And then we'll exhale, slowly release for 4, 3, 2, 1. Noticing how this intentional breath slows you down. We'll do that once more. Inhaling for 4, 3, 2, 1. Holding at the top, but let your shoulders relax just a little bit before you release for 4, 3, 2, 1. Allowing yourself to return to your normal breath. And we'll quickly do a scan of the body, starting at the top of the head. Perhaps you might look over your left shoulder and look over your right shoulder, or any other head movements that might feel good to release any tension in your neck. And then bringing the awareness down to your shoulders, releasing any tension you might have built up there, letting it flow down your back, feeling some weight into your pelvis, or if you're standing, down into your feet. We'll take one more collective breath. Inhale as deep as you can, filling your lungs, filling your belly. And release everything out, emptying out the lungs. Preparing ourselves for a fruitful discussion. Back to you, Kay. Thank you.
Thank you so much, Amanda. That was wonderful. I feel at ease now. I want to go over a couple of brave space agreements with you all. That's something that's very important to Me Too International as an organization. We want to hold a brave space together, and that means each of us taking responsibility for the health and well-being of the collective. To help us do this, here are our group agreements. The first one is respect the space. We are gathering here today to learn more and to learn ways to take action. Approach the conversation with compassion and curiosity rather than judgment. We know that any conversation about sexual violence can be an uncomfortable topic. We also know that it being a public health crisis can bring up a lot for many folks. As our panelists share their perspectives and visions, remember that this is an invitation to us to learn and grow. Let us approach the conversation with curiosity and compassion for ourselves and each other. Use the chat to show love and build community. I saw we had some people from Bowie, Maryland. We had some people from Florida, Richmond, California, Brandeis University. So we have a lot of people from all over in here, and it's awesome to see you all. If you find yourself feeling overwhelmed and you're seeking support, we will be putting resources into the chat for our healing portal, Survivor Sanctuary. And if you need any extra support, you can direct message Carlisa or Denise or myself. Take care of yourself. If you feel triggered or need to otherwise step away, please do so. This session will be recorded and available on Me Too's YouTube channel in the coming weeks. It will be here when you need to come back to it. Now, I will be introducing our lovely moderator. I would like to welcome our moderator and CEO of Me Too International, Dani Ayers, to the conversation. Dani Ayers is a movement infrastructure architect, as well as an organizational development and strategy executive. She has spent 17 years uncovering and understanding what influences organizational health and viability, specializing, oh my goodness. Okay. Specializing in building the plane while flying it. Her focus is the multi-layered work of racial and social justice, gender equity, and education. As the Chief Executive Officer at Me Too International, Dani oversees the various verticals of the organization. She has built Me Too's foundation and infrastructure and is leading day-to-day operations. I will now hand it over to Dani.
Thank you, Kay. Much appreciated. Great to be here. Again, I'm Dani. I use pronouns she and her, and I serve as CEO of Me Too International, and I'm really excited for this conversation. It's going to be wonderful. And so for Me Too International, for those who don't know, we were founded in the aftermath of the viral hashtag moment, when we saw millions of people come forward about their experience with sexual violence. But Me Too as a rallying cry existed long before hashtags, and activists and scientists and organizers like the folks here in this space have been ringing the alarm to raise awareness and demand urgency in response to sexual and gender-based violence for decades. What the hashtag did was serve as a reminder that although 1 in 5 women and 1/4 of men in the United States experience sexual assault in their lifetime, there has not been a response that's adequate enough to shift the way we think about harm, accountability, and healing. Despite the proclamations and promises made by current and past administrations, there just hasn't been a true and lasting commitment to disrupt the patterns and systems that allow for the proliferation of sexual violence. Survivors and allies have, however, been bringing to light the impact that sexual violence has on mental, emotional, physical, and financial well-being, both in the immediate and in the long term. It's because of survivors and allies that we know the effects that sexual violence has, not just on the individual survivor, but on the people that survivors give care to, work alongside of, and are in community with. Survivors and allies have been doing the work to put action behind evidence so that when we say sexual violence is a public health crisis, we know the implications that has and what's at stake if we don't address it as such. With that said, it's an honor to be moderating tonight's discussion and to be joined by this amazing panel of experts who have prioritized gender-based violence in their work through research, education, and community organizing. I'll start with some just really brief bios. We cannot, by any stretch, do justice to these folks' full career path and lives, but I'll share a bit about each of them, and then I'll kick it over to have each of them do a quick intro of themselves and an intro question. So I'll start with Dr. Angelica Geter, who is the Executive Vice President of Strategy and Business at Black Women's Health Imperative. And as a public health expert for more than 15 years, Dr. Geter has co-authored at least 30 peer-reviewed publications on racial and ethnic disparities in the Southern United States. And her research has been used to advance national recommendations, programs, and interventions. Welcome, Angelica. Next, we have Jaclyn Friedman as an activist and advocate and organizer and the founder and executive director of EducateUS, the first ever national C4 advocacy organization dedicated to build a movement for universal public sex and relationships education. Her first book, Yes Means Yes, Visions of Female Sexual Power in a World Without Rape, has inspired new laws in 5 states, as well as policies on countless campuses around the country and around the world. Welcome to you, Jaclyn. And David S. Lee is the deputy director at Valor and the director of research and evaluation at the National Partnership Reliance. Highlights of his work include the use of social marketing to prevent sexual violence, sport as part of the solution to end sexual and domestic violence, peer education programming for youth, faith community engagement in violence prevention, and engaging men to prevent men's violence. Welcome to you, David. So I want to jumpstart the discussion here with a definition. We have said already tonight that sexual violence is a public health crisis. We know that last year on April 1st, the start of Sexual Assault Awareness Month, the Biden administration also declared that sexual violence is a public health crisis. But I want to read the definition for you so you can sort of understand the framing of how we're coming into this conversation. By definition, a public health crisis affects large numbers of people and is determined by its long-term effects. Sexual violence impacts nearly every person in the United States, directly or indirectly. Sexual violence creates health and wellness issues for survivors and their communities. And there's a causal link between the experience of sexual trauma and the fallout from a lack of adequate recovery support and resources. So with that as the backdrop, I'm going to bring into this conversation our panelists. And I really want to ask each of you to talk about how this framing of sexual violence as a public health crisis shows up in the work that you do every day and in the work that your organizations are committed to. I'm going to start with Angelica. Can you kick us off?
Absolutely. Thank you again, Dani and the Me Too movement team for all of the work that you've done to create this safe space for us to come together. When the question is framing around sexual violence and public health and how this shows up in the work that we're doing at the Black Women's Health Imperative, when you talk about systems level change and resources that are needed and what should be available, we think about policies and programs. We think about what is actually established so that people can use the resources that are available, how accessible are those resources, and how do we create the policies that need to be in place so that when things happen, the system can move quickly. When things happen, people can get access to mental health services and so on and so forth. So for the Black Women's Health Imperative, it's about policies and programs to ensure that we promote systems level change.
Thank you so much. I am going to have David come in next to respond. Welcome, David.
Wonderful, and thank you so much. And it's so great to have so many people from all around the country, and I see beyond the country, joining us today. And thanks to the leadership of the Me Too movement for having this important conversation. I started in the movement to end sexual violence over 40 years ago, and I was trained by early feminist leaders, and I was involved in the early efforts of men working with other men to be able to work to stop male violence against women, because we need to really recognize who's causing that violence. And in 1985, the Surgeon General of the United States declared violence to be a health issue, a public health issue. And I was intrigued at that time because I didn't know that what public health was. I thought they were the people that shut down restaurants that had bad food or something that got you sick. And then as I explored that, I began to learn about the public health gives us a really great lens to be able to understand the issue. And I think it's important for us because when we look at sexual violence as a public health crisis, we're recognizing also that there's public health solutions that we can use to advance our work. And that that the movement in the United States has dedicated much too justice solutions, which end up perpetuating the problems that we're seeing. And so public health gives us a lens of thinking about how we can create community level and change. And so the work that I do at Valor, both in California and nationally, has been really trying to marry the activism that I was raised with the science that I've learned in public health, to be able to think about how we can be able to do community-led methods to be able to create change, that we can advance policies that are going to make a difference, ways that are going to create investments in being able to not just support those who have been harmed, but to actually prevent those from causing harm and to be able to change the conditions so this won't be happening anymore. And so this is something that to me becomes an important way for us to have our pathway to the change that's necessary. We know that criminalization will not end sexual violence, and we have to change those conditions and environments, that it's going to take much more than raising awareness, as Dani said, but it's going to be ways that we're going to change the social norms, teach skills, strengthen leadership, and create protective environments and support survivors.
It takes all the things, right? Jaclyn, why don't you jump in? Welcome.
Yeah, thank you. And yeah, yes to all of that. And it doesn't take much provocation to get me talking about how we should be always calling April Sexual Assault Action Month and not Awareness Month. Awareness is maybe a tactic for addressing a public health crisis, but it's certainly not a goal. We need systemic action because it's a systemic problem. And that's what I'm so grateful for Me Too's leadership on this and the framing of this conversation. The reason I'm working on section relationships education is because of that public health crisis, and because I've been a anti-sexual violence advocate since I was probably 19 or 20, shortly before I was myself sexually assaulted. And I thought that being sort of a smart advocate would mean that I would be too smart to get assaulted. But of course, we know that's not true. Again, that's about putting individual responsibility on people instead of taking systemic action. And I spent the better part of my career, as you mentioned in my bio, popularizing the idea of affirmative consent and changing our ideas around consent and what is sexual violence and what is consensual sex. And I kept hearing over and over again from survivors who would say, I wish I had this 6 years ago. I wish I had this 8 years ago. And I started thinking for myself about what I needed. And what I needed wasn't just for me to have had sex ed. Sex ed wouldn't have me having sex ed wouldn't have prevented me from being assaulted. But what might have is if the guy who hurt me had it, had really understood sexuality and consent differently, and understood at the very least that there might be consequences. Morally, community-wise, I don't mean carceral consequences. And so that's why I started focusing on prevention. And sex and relationships education is primary prevention for sexual violence. And it is one of the approaches that we're talking about here today in terms of taking a public health approach to this crisis, because when we leave it to the individual, we all are isolated and we suffer. So we're here to make change. I want to rip this out at the root. And I'm really excited to get into it with you all today.
Thank you so much. I love the various perspectives that you all bring and the work that you all do. It's, I have to give kudos to my team for thinking of each of your lines of work as being a really great way to round out this conversation across policy, prevention, behavior, all of the things. So I'm going to come back with some questions that'll dig a little bit deeper into what you all have already shared and the work that you are doing, uniquely doing. And so I'm going to go back to Angelica and ask, how do you see sexual violence impacting the mental and physical health of survivors, just as like a base for us to have a base understanding of that?
So I always, when I talk about this topic, I always have to take a deep breath. As a survivor of sexual assault, I know very well the answer to these questions, and thinking about how in my personal experience, as well as the people around me and the things that they went through, their physical and emotional health and well-being, and how someone can feel unsafe in their own body and not feel safe in their own home and not feel safe in any given space and places that are supposed to be deemed safe in their communities and even with their families. It's the emotional toll that it can take on you to question how you could have, quote unquote, put yourself in a position in having to rewire your mind and thinking about how an experience and an encounter this in this instant, it was something that was done to you. And it's something that you experienced, and to not be bound by that experience. So the physical mental, emotional, I could go on and on, psychological, financial toll that it takes on a survivor. And even when you think about survivorship, there are layers and levels to that. In addition to thinking about not feeling unsafe, but thinking about intimacy in a way that is healthy again, to want to have some type of intimacy with your partners and even with yourself. There is a lot of rewiring that has to go into survivorship, and even you defining that for yourself. There are a lot of layers to this work, and I have to take a deep breath when I talk about it. And thank you to a couple of the folks who have shared their experiences and their knowledge as well. I've been reading the comments as they come in, but the questioning, the doubt, the fear, the lack of safety, or the feeling of the lack of safety is a big part of the mental. The physical is the inability to be open and vulnerable and be wired for intimacy and love and receive it when you are ready. Those are some of the key things that happens to someone who may identify as a victim or a survivor.
Thank you. And thank you for saying just, that often in these conversations, we have to take a moment to breathe. We have to check in with ourselves. This is heavy conversations. And it's part of the reason why we do the grounding at the beginning of any time you come to a Me Too event. You'll see that practice. It's why we drop healing resources in the chat. And so I'll just take that opportunity to hold that up again. We have an amazing healing room that maybe someone from our team can drop in the chat, where it's somewhere you can literally go. There are various practices on kind of how to recenter yourself, especially in difficult moments where you may be activated or triggered. So we'll share that for folks, and it's free and it's available anytime. So you can take it with you and use it anytime you need a break from a moment where you're feeling activated. Thank you so much, Angelica, for that. And I think, it's part of the reason why Me Too centers healing inside of our work. You didn't hear folks as much prior to the last 10 years or so talking about healing the way that we do now. And it's great that there's an opportunity to think about the work to interrupt and end sexual violence as needing healing to be a key part of that. Otherwise, we aren't going to achieve a world without sexual violence. And so I am so glad that you talked about that. And it's a lifelong journey. And Me Too, it's a key part of what we do in the world. I want to take did I? Go ahead, Angelica, go ahead.
One part that I did not say that is I apologize for interrupting you, the spiritual aspect of healing, the spiritual part of survivorship that comes into question and sometimes can be regained and sometimes it's lost. And I think that we don't talk about that piece of it because you don't feel grounded and rooted. And I hope we can make room for that. However you define your spiritual journey, that is a big part of survivorship as well.
Thank you for calling that out. Yes. And the panelists know I've said this. Please chime in if you want to add something or you forgot something, or we'll move this into conversation mode for sure. So thank you for that. And I think, where we can go next is sort of thinking broadly, right? We talked a bit about what's required of our infrastructure, what's required inside of public health to address the issue of sexual and gender-based violence. And so I'm going to kick it over to David with the question, where have there been government investments? What are the public health investments that you've seen or that we need? And how have the investments that have happened made an impact or fallen short?
Well, thank you for this question. And it's so important because we're talking about this from a systematic perspective and how we're going to be able to do this. And if we want to make change, we also have to make investments to be able to do that. So I've been going through trying to figure out, looking at federal budget things, and seeing how much investments we make towards addressing sexual violence. And it's a little hard to set out because a lot of it's embedded with other domestic violence work within our budgets, and we can do pieces. There are some dedicated programs addressing sexual violence. But when we look at the whole of government, right now, the 2023 budget was $6.2 trillion of a budget. And then we look at how much investments are made to be able to address sexual violence. We're getting closer to the hundreds of millions. Hundreds of millions sounds like a lot, but when you do the percentage from looking at it, we're just picking a drop in the bucket. And that most of those interventions are going to be around providing services to survivors, or are ones that are going to be involved around the criminal justice system and trying to be able to criminal justice our way to address this issue, which is not going to be the way to really make the fundamental changes. We have been making some level of public health investments. So we see the rape prevention education program, which gets funded, which from the Centers for Disease Control and Prevention, which gets money to all the state and many territorial health departments, which is an important place. We've seen some research being done around the prevention of child sexual abuse and starting to emphasize those efforts. We're starting to see some way of being able to have conversations of looking at how to prevent and looking at college campuses and some of our Title IX. But I just want to say that if we want to make a big change, we have to think about making big investments, and that the investments, while great and are valuable, and I work with them and I want to see them, they're still only a drop in the bucket. And that, you know, I've been running percentages and they're all 0.00 something percentage. And so it's a way that we need to be able to find ways to get more to be able to do it. There have been many valuable pieces that we've done. As they say, there's been funding for counseling, there's been protections for immigrants, but there's been very little that's been done on the public, from a public health towards the public health solutions. And that we need to find ways to be able to expand those efforts to be able to do it. We need to make investments that are going to change the conditions. As Jaclyn talked about, we need to be able to have the way that's going to become the educate, you know, we're not putting the burden on potential people who've been abused to try to protect themselves. We need to put the burden on having people that don't cause that, so they won't be causing this harm. That we need to be able to create those effective environments. And so I've seen some places that we're starting those directions. I really appreciate the emphasis on looking at health equity issues and recognizing that we have to look at, if we're going to address our issues, we're going to have to address these other public health issues of economic insecurity. We have to look at the public health problem of racism within our country, because these are all intertwined. And indeed, if we are able to address economic insecurity, if we're able to address racism, if we're able to address the intense attacks on bodily autonomy, whether it's going to be around reproductive freedom or around gender affirming care, that these are all tied together. And as we need to be able to find ways to strengthen those investments and do that. And we have to support efforts that are not just supporting government actions, but are supporting grassroots community organizations to be able to make the change, because it's communities that are going to change community norms. It's not going to happen by an ad campaign put out. It's going to happen by people in communities making a difference, working with each other, using the strengths that exist in our communities. And so what I think there's been a beginning of places that we've seen some of the public health investments, but we have to start looking at this problem as a public health problem. That's why I'm so excited about this conversation. And think about then, how do we make that community level? In public health, we'll call it population-based. Angelica is appreciating the, but that just means the people. And so it's about finding ways to be able to get it that we have the people being able to make those changes.
Yeah, absolutely, David. And what comes up for me is, if the Me Too movement founder, Tarana Burke, often says this, we talk about this a lot inside our organization, that if we treated sexual violence like we've treated other public health crises, if we treated it like, we treated the pandemic, if we treated it like we treated smoking cessation, right? Look at the impact we've been able to make when we look at something as a public health crisis that requires the wraparound. These are the same building blocks that we have here. And there's so much of a roadway that's led us here that we can see what would work from a holistic perspective to really intervene. So I just appreciate that. Go ahead, David. Yeah.
So let's give an example. You know, if we look at what's allocated to the National Cancer Institute, that's $7.3 billion. What if we made that type of investment towards sexual violence prevention? We have a, we have a division of violence prevention, the Centers for Disease Control. We have HHS and some of the work that we're seeing there. Let's make those investments there to be able to do something. Let's do the research. Let's pilot the programs. Let's support those community efforts that we're seeing different. And that's where we can really, I think we can start making a difference. It's a very different way than we have been approaching it for the last 40 years in this country.
Exactly. Well, this conversation is part of the journey, right? We're hoping this is sparking some things in individuals who are in the room. We have 320 people here with us right now, so many more will watch. So this is just one moment, right, on the continual fight. I want to take a pivot to this conversation to bring in Jaclyn to talk about some of this. I see in the chat that some folks were talking about behavior and talking about prevention. And so Jaclyn's a perfect time for you to come in and talk about some of the barriers that we see facing the type of education that you do around sex and relationships. What are the barriers that we face in terms of getting at some of this prevention work, and what are some of the misconceptions about it as well?
So many barriers. Let's take them a few at a time. One that I referred to earlier, which is simply individualism, right? That sort of like extends especially to your kids. Like, I want to talk about this with my kids. It's none of anybody else's business what I teach to my kids. Whereas we're clearly saying like, that's not actually true. We're all going to be in relationship with each other. We're all going to encounter each other in a variety of ways. And that's why we need community-based universal education and not just whoever's parents want to opt them into it. Racism and transphobia, real talk, are some of the biggest obstacles we're facing right now. We're seeing wide-scale attacks on public school education on a lot of levels in terms of being honest about America's history and about racism, about whether or not queer and trans kids are allowed to exist in schools. And all of that legislation actually impacts whether it explicitly calls out sex ed, in which sometimes it does, or whether it doesn't. When we see bills that are being taught against teaching, for example, divisive concepts, which are generally meant to be targeting teaching about race and racism in school, well, guess what gets called a divisive concept the minute you pass that bill? When we see bills that are being introduced and passed banning, addressing diversity in sexual and gender identity, that makes it impossible to teach honest sex and relationships education. And so we really need to see, honestly, I would add the institutions, David, that you rattled off in terms of where the public health crisis is. The public health crisis in education is a real issue here too. Our education system is under an all-out assault. To that end, I think that the generalized left is slow to that fight. I think the right has been paying attention to the power of controlling public schools for a lot longer. And so there's just been a slower response from progressives on really paying attention to schools and understanding that schools are a community issue, right? I've heard from friends who are very politically involved who said, can I come speak up at the school board meeting about the challenge to our sex and relationships curriculum? I don't have any kids in the school, right? Again, that lack of understanding of this as a community issue that sets the culture and the health of the community on the right track. And then there's also like a fundamental misunderstanding about what sex and relationships education is and what it does. A lot of people, because most of us in this country got terrible, if any, sex and relationships education. We don't have the expansive understanding of what's in the curriculum. that it does teach about bodily autonomy and consent and boundaries and emotional literacy and learning how to handle rejection and, you know, all of these important building blocks to having healthy, non-violent relationships that we know are preventative for violence. And then lastly, I would also say, I think that we always wind up talking about men and masculinity in these conversations for many good reasons. But one of them that I don't think that gets addressed often enough is that sexual violence against men is wildly underreported, even more underreported than sexual violence against women. And I think that if people understood that if they wanted to show solidarity with men, they would show solidarity with survivors instead of showing solidarity with perpetrators. It really could shift a lot of our conversations. That what I'm always reminding people is that if you feel like you want to stand up for men, please understand that men are much more likely to be a victim of sexual assault than a perpetrator of it. So if you want to keep men safe, if you want to stick up for men, this is your issue also. And I really feel like that's in the way as well.
Yeah, thank you for that, Jaclyn. You know, so often men are not part of the conversation around interrupting and ending sexual violence. And the reality is that men's first role in this work is as survivors of sexual violence. And we know that the numbers are incredibly underreported, as you mentioned, and we know that they have increased. Especially in the wake of the pandemic for both men and women and those across the gender and sexuality spectrum, the numbers are not going down, they're going up. And so, yeah, I think that's such an important point on the role of men in this work. So speaking of the work that we kind of do, I want to just give folks an idea. I want folks to understand kind of the work of each of your organizations and what you all are doing to address urgencies in public health, to address urgencies in gender-based violence. And folks, feel free in the chat to also include some of the things that you or your organizations are also doing. I'm going to circle back to Dr. Geter and see how Black Women's Health Imperative, how you might answer this question.
So our organization, for those of you who have not heard of the Black Women's Health Imperative, we've been around for 40 years. Our organization was founded on reproductive justice, moral standards, values, creating opportunities and resources for people across the country to ensure that there's a systems level accountability and that resources available for those who need it. Our founder of the organization is Billy Avery. We are excited about celebrating our 40th anniversary this year in September. We will start the conversation in Atlanta, Georgia. We're taking it to LA and a couple of other cities across the country. The key to what we do at the Black Women's Health Imperative is thinking about the systems level changes that need to be in place to ensure that these things don't happen. About 90% of us have a background or experience, knowledge in public health, and we use that knowledge to move beyond just the conversations of equity, but getting truly to the justice components of this, getting truly to the prevention and opportunities to establish more programs, more resources, but changing the system when we actually encounter those programs and those resources, engaging community leaders, engaging political leaders, and having those conversations with them to ensure that they are educated about what's happening to those members of the communities that we say we want to serve. So when we talk about the Black Women's Health Imperative and what we're doing, we're looking at it from a programs, research, policy, and community standpoint, and engaging and making impact on multiple levels.
Amazing. Yeah, I'm sitting here just listening. Oh yeah, I'm moderator. Let me come off and listen and put the transition in. Yes, thank you so much. I appreciate that. So I'll shift over to David to chime in around Valor's work.
Well, it's great. I'm already taking notes on Angelica's, and so I've already sent a message saying, oh, we got to connect on that. So thank you. So I'm learning. So a lot of the work we do at Valor is working on helping build capacity and help support people in the work that they're doing. And so a lot of our efforts. So I want to highlight just a few examples of what I think are some exciting work that we've been doing work with. So in California, we're working with the Yabasta Center. This is a group of janitorial workers who are being trained to be able to provide training to other janitors about sexual harassment and sexual violence prevention. And so what they have done, and they've got, are being able to actually have
Oh, we'll see if David comes back here.
or not.
Oh, you froze for a moment.
My screen froze for a moment. I noticed everyone else was frozen. So I talk about janitorial workers and doing training. And so it's survivor-led efforts of being able to have peer-to-peer training to be able to move forward. This is a really exciting effort that we're seeing of being able to make a difference and be able to, within their own community, talk about whether it's rape on the night shift as a janitorial worker, and to be able to find ways to address this. And I've learned so much from the janitors who are speaking up and making a difference in the world to create safe work environments for themselves. Another effort that's real exciting is a community mobilization effort called Close to Home. And this is right now being implemented with actually rape prevention education funding from the CDC through the California Department of Public Health. And this is training different community people to do classic community organizing around the issues of sexual violence prevention. It's about bringing together people, listening to what their concerns are, developing action plans that make sense from the community for the community to then work towards shifting the norms in their community. From a public health perspective, I'm excited because the CDC is investing in some intensive evaluation so we can evaluate this and soon become that standard of what is necessary for understanding the evidence to having it be an evidence-based program. And so that these efforts that I've seen, and I just was at a meeting of several of a training for these organizations, and it's incredible how they're helping bring forward the voices and creating creative actions. I think that we need to work with researchers to be able to do more research. The work out of the Moore Center for the Prevention of Child Abuse at Johns Hopkins is really talking about how child sexual abuse is not inevitable, it's preventable, and that they're trying to be able to look, and they're developing programs that are working on preventing the perpetration of violence, and I think it's an important piece. Over at the University of California, San Diego Center for Gender Equity and Health, this week, they're going to have a forum where they're bringing together stakeholders and researchers together to look at how we can be able to advance policies that are going to be able to advance prevention efforts. We do work. Valor's national project Prevent Connect brings together prevention practitioners, and we have thousands of prevention practitioners who gather and share and learn its resources. And I want to invite people to join us at the National Sexual Assault Conference that's going to be held in August in San Francisco. And this is going to be the first National Sexual Assault Conference in 4 years. And we're going to have a robust prevention track. And we're going to have the conversations together about what we can be able to do to be able to create. The theme is equity in action, because we know advancing the equity is so necessary to what we're going to be able to move forward. So these are the ways that we're doing it, in addition to advocating for policy change and funding. In California, we're asking for $40 million for prevention efforts. We've gotten $30 million in the last 4 years. We need to continue these investments. When economic times get hard, you have to invest more, because we know that violence even escalates in the harder economic times.
Thank you so much, David. There's a few things that I want to make sure our team gets. And what I'm hearing is some of these things that you all are talking about, what we'll do is we'll collect Some, if there are links to those things or places that folks can find out more information, we'll collect those and share back with the registrants for the Zoom. So folks, if you're asking about specific programs that folks are talking about, we'll collect those from the panelists and share them out afterward. And then also we will do, this is being recorded and it'll end up, as Kay said, on our YouTube channel. So you will be able to see this afterward as well and revisit anything that was shared. Jaclyn, I want to kick it to you to talk about your work.
Yeah, so we are a C4 advocacy organization, which means we get to do direct community and political organizing. So that is what we do. We do that in a number of ways, always with the folks on the ground in the communities that are impacted. So we're a national organization. We don't go anywhere. We're not invited. But the flip side of that is, if you want to work with us and you're a community or state local organization, hit me up. Would love to hear what you have cooking. Would love to see if we can make something happen together. We're working in California, actually, David, on implementation challenges. So California has a great, probably one of the best sex ed laws in the country, called CHIA, but there are a lot of communities that are ignoring it outright, especially communities in the Central Valley, largely farm worker immigrant communities. And we are working in one of those communities that I'm going to strategically not name right now, to organize, in fact, tonight or tomorrow, part of the UCLA Law Repro legal clinic that we're working with is going to be in that community doing Know Your Rights workshops with students who are wanting to organize to get the education that the law says they deserve, but they are not currently receiving. So we're doing that kind of organizing in California. We are also do a lot of work on how to change the narrative, to how to sort of shift the conversation, because that is part of what the obstacles. So we do research on what kind of stories and messages move people to want to take action, to vote for pro-sex ed candidates, to talk about it in public, not just to say they support it, but to take that kind of action we need them to take. In New Jersey right now, we have a first of its kind deep canvassing pilot where we're trying to develop a script that helps to do the deep work of moving people through their fear and bias, not just to support sex education in the schools, but we know that in 2023, that means we know we need to get them to support trans kids, right? Fundamentally, that's one of the #1 things we're hearing is like, when you scratch the surface, people are freaked out, and we need to move them between their fear, through their fear and bias, and help them self-persuade so that that persuasion lasts a lot longer than a sort of like, let me hit you with a few points kind of conversation. So we're doing that deep work, sort of discovering how to help people change. And then we're doing nuts and bolts organizing, right? So in Michigan, we're working with state level organizers as well as local folks in their own communities, trying to connect them so that when something starts popping off in a particular community, the state level organizations that have more resources to mobilize a response know much faster and can mobilize a response, because a lot of times what happens is these extremist opposition groups look like they're majority just because they know what time they're starting that shit. And then we're flat-footed. And so we're really trying to get the jump on them in Michigan and build a system where we know what's happening before it's happening. In Pennsylvania, we're working to elect better candidates to school boards. We're doing that nuts and bolt organizing at the ground, but we're also working with a great organization in Pennsylvania called New Voices for Reproductive Justice, which won an amazing victory for sex and relationships education in Pittsburgh, and now wants to figure out how to take that model and make it win all over Pennsylvania. So those are just like a variety. Yeah, New Voices. Every time I have a meeting with them, I'm like, yay. So that's just like a sampling of what we do. We also have tools for folks who may just be individuals listening. One of the best ways to get involved and easiest ways that I'm just going to drop in the chat is to take our sex ed voter pledge. All that means is that if sex ed is going to be on the ballot near you, so that's usually a school board or state level election, we're going to let you know. And we're going to let you know how to get involved, how to know which candidates to vote for, that sorts of stuff. But there's also all kinds of tools for organizing our website, including a Facebook affinity group toolkit. So if folks want to start some community support for sex and relationships and violence prevention education in their schools, one of the best ways to start is to start a Facebook group and see if you can get like-minded people in your community to join. And so we figured out that actually that was a really hard thing to ask people to do because they didn't know where to start. So we just made a toolkit that makes it easier to do that. So the other part of my job was just always figuring out what's in the way and then figuring out how we can build a resource to move around that obstacle.
Yes. Amazing. Yes. Thank you, Jaclyn. And yes, we will share out these resources again that folks are sharing. So we have your email addresses if you registered for this webinar, which if you're here, you did. So we will definitely send out the resources that are being mentioned to you all. And I believe someone dropped in the chat our YouTube channel, which is where this will land. I'm going to ask one more question of the panel, and then I'm going to shift to some Q&A. And so as I think Denise dropped in the chat, if you have a question, feel free to use the Q&A button and drop it in there. And we will answer a few questions before we wrap for the evening. But let's take a few more minutes to answer a final question here as folks are thinking about what they may want to ask. And that's going to be around public interventions and community response. So this is a question for all three of our panelists. What does a strong community response look like? What does public intervention look like, even if it's a direct public intervention or a mass public intervention, whatever kind of comes up for you there? And then who is accountable to meeting those demands? Who do you see as being a community of folks who need to respond to those community demands and those public interventions? And I'm going to go back to Angelica, if you're able to answer for us.
Absolutely. Yeah, by now everyone knows I'm all about the policy, I'm all about systems level change, I'm all about addressing those problems that really create a whole lot of barriers. When Jaclyn was talking about removing the barriers and working your way and finding the solutions to get around those barriers, I feel like I found my people, because I feel like we're all trying to find a way to promote systems level change in so many different ways. And so when we were talking more and thinking more about community and how we define that, we talk about public intervention, how we define that. For me, community is nothing without our local and state leaders being involved. I really and truly do believe that we cannot continue to have the very people who are oppressed being put in a position to have to change the system, and we just have to do it ourselves. We need people who are in positions of power to adjust and use that power to change the systems that are in place. And so when I think about community response, it includes local leaders, public intervention, it includes those local leaders. And when I say local, I mean your mayors, your city council members. I mean the very people who are in position to provide money for resources, opportunities, programs, implementing interventions across the board that can offer up a standard for how things need to be done to promote a certain level of accountability. An example of that, and we've all mentioned California in some capacity, and multiple initiatives that have been put into place across the state. And if states and local leaders need an example of that, then they can turn to that state for an example. And I'm hoping that Jaclyn and David can provide a few other case studies for them. But when I talk about community, I am speaking to, and knowing that we have stakeholders, leaders who are engaging, but I really want our local and state leaders to think more about what they can do to promote systems level change and remove the barriers, offer up prevention, insert more education along with everything else that we've discussed today.
Yeah, so important. The other thing I'll add to that that, I think a lot about is how we encourage, inspire our survivor allies to also move into positions of leadership and to support them in running for office, so that we can have folks who are making decisions from an identity that includes survivorhood. Because we know that survivors are squarely the individuals who we should be asking for the solutions to interrupt the issue, right? And so the more that we can bring people into power who identify as survivors, the safer we will all be. And
Yeah.
I
want to add on to that. So when you talk about putting people who can operate with a sense of empathy and kindness and grace and understanding to promote systems level change, I really and truly believe, because that's essentially what you're saying, right? Offering up those opportunities. I think that we need to implement some type of technical assistance to encourage people to do that and show them how to do it and do it effectively. There are a lot of people who are interested. There are a lot of people who want to change the system, but they don't know where to begin. And imagine if there were some tangible tools and resources that help people feel empowered to do just that. And most of the time, what normally happens is that the very people who can operate with grace and empathy and kindness, they don't get to speak up, or they choose not to, or they're just sharing their stories within the community, but they aren't taking on the leadership roles. So I'm so happy that you said that. That actually aligns with the conversation that I had earlier today on another panel. So thank you for offering that up, Dani.
Oh, absolutely. Thank you. So I'm going to move it to David. So what does public intervention look like in your vantage?
Well, I mean, yes to everything Angelica said. I want to expand, and I know Jaclyn's going to has already started the school board conversation of running for school board, but we have to look at our other institutions, because people live their lives in other institutions, whether there are faith communities. And, I was part of efforts within my synagogue to be able to find ways to be able to develop policies and come up with procedures and find a way that we're going to be able to address the issues there, and that we have to be able to do that because that's a place which should be a place of support. And it should be a place of caring and of spiritual growth, as opposed to a place just of harm. And so we need to be able to find ways to look at those institutions. We have to hold our businesses accountable, that the businesses in our world, and there's ways that to call on them to be able to do actions, to be able to understand and look at what they actually, how sexual violence and sexual harassments take place within the
We'll see if David comes back. We know Mercury in retrograde has been hit.
Now I'm back.
Okay.
I see. Yes, my internet has not been nice to me. So yes, I said businesses, and we had to hold businesses accountable. And I think that these have become important institutions that we need to do it. I think sport is an important institution that has an incredible impact in people's lives. So many young people participated, so many go Warriors. So I know those are fighting words for some, but I think it's important that we hold our teams and our institutions responsible, and that we need to hold there, and we need to find ways to target those, and that's how we're going to be able to build our change, is that we think about what institutions we have ability to have some influence over, think about how they can be able to do it, develop concrete steps, create chances for these institutions to be part of the solution. We have to take a little bit of a vision to be able to do that, and then have those expectations of them and be able to hold them accountable. So that's why I want to expand this to not just electeds, but also to our other unelecteds who also mitigate so much of our life.
Absolutely. Plus to all of that, David. Thank you. Jaclyn, jump in.
Yeah. Oh gosh, so many different directions I want to go in. They're competing in my brain. I would say the best thing to do is really just echoing what Angelica and David have already said, which is figure out where you have power, and then that's where you have power, right? But also don't do it alone. Don't fall prey to the idea that you have to figure out some brand new solution. Like, look around and see who's already working. I know I keep plugging our website, but it is chock full of practical resources. And one of the resources on it is a map of where there are already organizations we're connected with working on advancing sex and relationships education. And you can just find out if there's already something near you. We don't all have to lead. Every movement actually needs followers. So like getting connected is part of how we make a mass intervention. You need lots of people connected with one vision and one action in order to do that, which means not everyone has to make up what the action is. But I would also say to think about if you're feeling overwhelmed and paralyzed. I want to share some advice that a friend gave me shortly after Trump was elected, and I was feeling like I need to intervene everywhere in every way. And then I was on full tilt. And she said to me that I should think about prioritizing two issues. One that is very near and dear to my heart already, that's sort of like core to my identity, and one that feels like a stretch, like something where I'm showing up as an ally or in solidarity, right? And that make those my two priorities. And then not that you don't care about everything else, or you're not going to sign the petition or show up if you can, but that those are your two things that you're going to focus on so that you don't feel paralyzed and overwhelmed. Because I think a lot of times the obstacle to building that mass power is that we all feel so overwhelmed all the time. But I also want to just wrap my piece of this up by talking about some public interventions that have inspired me recently. I can't not talk about the student walkouts that started in Virginia in the fall. We did play a small role in helping to support Pride Liberation Project, who organized them, I'm proud to say, and inspired student walkouts around the country, some of them directly about sexual violence. Students know, and they're not being quiet, they're organizing, and that is really incredible. But also, I don't know how many of you have been following the Nebraska filibuster, but it's a great example of some folks who didn't feel like they had power, but figured out a way they had power, right? So Nebraska, I'm going to be real nerdy for a second. I promise it'll go fast. Nebraska has a unicameral legislature. That just means there's not a House and a Senate, there's just a Senate. And progressives, as you might imagine, are a small minority in there. And some extremists on the right introduced a bill basically banning all gender affirming care. And in every other state this has happened, where the majority has been what it was, it's just sort of happened. But a couple of senators who said, like, absolutely not, started a weeks-long filibuster, and their session is only 3 months, I think, saying literally, we will not allow any bill to move until this bill is over. And they held up the session. They almost did it. They held up the session for over a month. And they exacted an incredible cost for the pain that the opposition wanted to inflict. And just the fact that it didn't win in the end doesn't mean it didn't have an enormous galvanizing impact on everyday Nebraskans about what's possible. And I don't mean that all of us should be state senators and do filibusters. What I mean is we need to look and see where's the place where we can stick our bodies in the gears of the machine, right? Where is the pain point that we actually have some control over? And figure out, and if that feels too scary to do by yourself, like, you have to find friends. You have to do it in community. Again, we have to break down the isolation of individualism. It's a toxic lie. So don't feel like you have to be a single-handed hero. That's why we build community first, and then we find those opportunities, those breaking points where we can insert ourselves.
Thank you, Jaclyn. Appreciate that. Appreciate that example too. I'm going to hop into the questions. We will not be able to get to all of them, but I will tell you this. I am happy to facilitate getting those questions to our panelists to respond to. If you would like to send them to info@metoomovement.org. Someone will put that in the chat, and you can send any questions we don't get to that email, and we will send them along to the panelists. I'm going to start just in order of who submitted them. So Claudia Llamas Padilla asked, do you have any advice? And this is for anyone on the panel. So anyone who feels moved to answer, feel free to chime in. Do you have any advice for agencies to start working with or strengthen relationships with public health departments, specifically around sexual violence as a public health crisis? Anyone want to jump in around that?
I can start, and I know Angelica lives in the public health world too, so might have thing. So to me, it's find the place where there's the greatest interest. And so it's often start with those strengths. So every public health department, public health department does have rape prevention education funding. And so finding out, but it lives in different places in different states. So some states it's in women's health. Some of it's in maternal and child health. Some of it is going to be in injury prevention. And it's all over the map. Some of them, they're really dedicated and have dedicated staff. Some of them, it's someone's got a responsibility that's been put upon them in addition to 3 other topics. And so, but find the person who's going to be the ally and the interest that's helpful, because they can help you navigate those systems, because they're very different systems and often very siloed. I find it very frustrating to see how women's health and sexual violence prevention are often very different siloed pieces, and they don't talk to each other, and they're not finding ways that be able to connect, and that we have to be able to find those. I would also educate yourself in understanding some of the public health literature that has been going on. There's a nice package that the CDC has put together called Stop SV, which is a technical package looking at strategies around sexual violence prevention from a public health approach, to be able to have those conversations. And that I think it's going to be, but then it's also to remember that for those of you who are experts in sexual violence, you want to also make sure that you're an important leadership piece and you help drive where they're going. This is not up to public health to define what's going to happen. Public health has some great lenses, and we want to be able to provide those tools. So that would be my start.
What I would add to that, because I think you've given most of what I would say, the only couple of things I would add to that is going back to just some of the basics of telling people how to connect. So figuring out the websites that you need to be on, who are the people that are in leadership, going to the organizations or the health department's events so you can connect with those people in person, learning more about how to build community and connection, because most of the time you want to engage folks who are in leadership, but you haven't connected with them before. Emails can be highly ineffective when dealing with local, state governments, so on, federal governments, so on and so forth. So doing the basics, in addition to what David mentioned, of trying to connect and build those relationships with folks, with the leaders of these health departments and public health departments is so essential. Also getting clear about the structure. Half of the time, people think that one group is in charge of something, and the reality is that they are not. Perfect example is Atlanta. The city of Atlanta does not have a health department. It is the county that's in charge of the health department. So you have to get clear about who's in charge of what and what those relationships are. Doing that background work will help you be more effective and to build those relationships.
I would only really quickly add that if you find yourself in a roadblock because the wrong person is in the wrong position, that's a time to think about where the regulatory chain is and who appoints that person to that position. So I think that a lot of times we focus on legislation and we don't push for regulatory change. And sometimes regulatory change has to come with changing the personnel in those regulatory offices.
Thank you so much. And I'm just going to ask, so we only have time for one more. I'm so sorry. And I'm going to pick this one because I think it's because we didn't get to all the questions and because folks were doing so much sharing in the chat, and there's a lot happening, right? And I think sometimes we feel like we're working in silos, and a lot of times we are. And so I wanted to ask this question that someone put in the chat about social media and about how to use social media for this work. And so the question was, what or how can we or should we use social media and other ways to share ideas and information with various communities to promote community change? What have you found to be most successful in your work? What have you found to move the needle in terms of communications, whether it be social or whether it be something else? And that anyone can start.
I would just say a couple of things. One is to be really clear about what your end goal is. So a lot of the times we get really excited because something goes viral on TikTok, but the result of that is that it went viral on TikTok. And so I'm always thinking about how to move people who engage with us on social media to a place where we can build a deeper relationship with them. The initial step of that would be our email list, because also the reality is that TikTok or Instagram, any of these platforms can shut down your account for no reason at all at any moment. And they are very hostile to some of our work, is what I will say about that. So, you know, in terms of content to put out there to get people's attention, I don't think I have anything more innovative than anybody else has to say. I regret to say that memes do incredibly well for us. Twitter, honestly, we don't have time to address Twitter right now. It's too mess right now. Twitter's like a whole panel. So like, you know, my advice is for your community to try a bunch of different types of messages on social media and see what people click with. But then there should always be thinking about that call to action. Like, what do you want people to do except beyond agree with you? When we all just keeping on agreeing with each other on social media, it really does not get ourselves very far. So using social media as a tool to drive some other action is what I encourage as a frame.
Okay, and just one, we just have time for one more comment. Angelica or David, if something's coming up for you right now, please chime in.
Go ahead, David, you got it.
Okay. Well, I mean, to me, it's getting the most people isn't what's important. It's getting the right people is what's important. And so let's think about, so if you're trying to run a campaign in your city government, then you're going to want to target your mayor, and then you're going to want to know who influences your mayor. And so maybe just, you know, that post from the people that have influence is going to make a difference. So it's about trying to be able to do it. We're all sort of in love with the massive numbers, but it's the impact that we're doing it. And remember, social media is just a tool. It's not an end in itself. It goes back to old school organizing. It's about getting what you want and you influence. And for some people, it's going to be a tweet. Some people, a tweet will make a difference. For some people, it will be a shared Instagram post. Some people, it's going to be an op-ed in the local paper. For some people, it's going to be a phone call from the right person to the right person.
Thank you so much. Clearly, we could go on and continue talking throughout the evening, but I am going to be respectful of everyone's time in the space, both the panelists and everyone who is with us. So I'm going to go ahead and wrap us up. I just want to thank so much Angelica, David, Jaclyn, for being in this space. And sharing not only your experiences and your expertise, the work of your organizations, your perspectives, but just bringing your energy, bringing who you are as human beings into this space. We are so grateful on behalf of Me Too. We are so grateful to have you. We're so grateful that everyone who joined. And to close us out, I'm just going to kick it back over to Kay. So thank you.
Thank you, Dani. Thank you, team.
I was on mute. I don't think you all can see me. Let me pin myself. Ta-da, I'm back. I just want to thank you all so much for that beautiful and informative conversation. Let's show David, Jaclyn, and Angelica a waterfall of love and gratitude in the comments. Thank you for being here with us and sharing in this way, for showing us ways that we can work towards imagining a world free of sexual violence. I also want to thank you to the Me Too team, Claudio for Spanish interpretation, Cynthia for ASL, and the audience for choosing to be here to learn about sexual violence as a public health crisis and wanting to take action. You can keep in touch with us and our upcoming activations via our website, metoomovement.org, and by joining our email listserv, Disruptors Digest. You can also text Me to Action to 24020 to join our SMS listserv. And you can engage with our healing portal Survivor Sanctuary at sanctuary.metoomovement.org. This recording will be available for your viewing pleasure on the YouTube channel in the coming weeks, along with an email with all of the resources that the panelists talked about today. Thank you all for coming.